Good morning. Thank you all for attending this beautiful December morning. I did have a flashback to remember the days of COVID when we were Zooming. This could have been a Zoom morning. Anyway, my name is Harrison Pierce. I'm the Chairman of Health and Human Services Commission. Alyssa McKenzie, unfortunately, is ill. She announced it with COVID, so it's not to be. Barbara's going to do she'll be
your
the
expectations
recording secretary this morning, which is just great. We do have an ex officio member of the Health and Human Services Commission. Our first selectman, Deanna Carlson, is what is the title there? So, and she gets a vote if needed.
At break times.
Oh my gosh.
Okay, first item on the agenda, approval of the minutes, November 7th.
I make a motion to approve the minutes.
Any questions, comments? I do have one question. So when we discussed last time, the groups, the grief groups in town, there are a couple with religious affiliations. And you made a comment, and I'm not sure I understood it. Is there no conversation of religion in your grouping?
No.
No,
No,
it's just,
it's just grief
okay.
and seafood.
Thank you. Any other questions, comments?
I mean, I put it out there.
Yeah.
And if they do find solace in that, I encourage it. But no, we are not a religious grief support group.
Okay.
Do we need to amend the minutes or? should we do-
No,
Just let know.
I don't think it said that.
Motion to approve? All in
Uh,
favor? Aye. Opposed? Thank you. And thank you, Alyssa. Health Department?
Jen Ielsen, Director of Health. So I sent you all our report. We're still busy, obviously, with building permits and septic still going strong. Food relicensing for the food service establishments began. That's all due by December 31st. And part of that is they have to get the tax collector and the assessor, and the taxes on their business, the personal property taxes have to be paid in order for us to license. And that's per Connecticut general statute, not of the land, just on their equipment in their establishment. So right now we're going strong with that. More will be coming in now that we're in December and we're after, Thanksgiving. Shannon's community health updates. The walking club is going to continue as long as the weather, holds out. They still want to continue to do it even when it's, cold out, which is great news. They all like the camaraderie.
How much do they walk? Is it a mile or?
It's an hour.
Wow.
So whatever they can cover in the hour. And they got a pretty steady same group that comes, so that's great news. The Shannon's been doing the Medicare counseling on Thursdays all day at Lapham. She'll be there today. Today's the last day of it. It ends today. Flu clinics, they're not as busy as last year, but still steady. The QPR suicide prevention training will be returning at the end of December. We have a date with the library. We couldn't do it during those months per the guidance of the QPR Institute. Staff training, Deb and Shannon both got the ICS 200 emergency response training this month. Last month, they did the ICS 100. Speaking of preparedness, on the 18th, I believe it is, it's a Wednesday, at Sacred Heart University, Region 1, starts at 9 a.m. Bob Kenny is organizing all local health departments, human services, nonprofits, nursing homes, all that to get together and do disaster response and recovery all day meeting to discuss what happens in a disaster and what everybody's roles would be. Waveney said they're going to attend. I contacted the Y, and many of our CERT team members are going, so it's going to be a good turnout.
I'll be there.
Yes, and Marcy's coming too. Thank you. So at least I won't be alone. And then we're planning too, as part of a preparedness, in January, mass casualty incident. It's gonna be, we're gonna do a tabletop first, and then there'll eventually be a full-scale exercise. And that will include EMS, police, fire, everybody. And then you also have all the charts, as you can see. This time of year, we're really not surprised to see some of the numbers for suicidal ideation. But it is lower than last month. And then, speaking of data, the Community Foundation, Meg reached out to me last night about attending the preliminary data sharing. And I'll be attending that with the Alliance. In January, they'll do it for the public. This is just a small group stakeholders. So it'll be interesting to see their data on that survey.
Jen, just a quick question. The QPR suicide prevention training, who all goes to that? Is that mandated? What is
Anyone can attend,
anyone can attend?
yeah.
Okay,
Shannon and I are the certified trainers, but anyone can attend. It's more meant for laymen, actually. But it's 2 hours and it's a cap at 10 people
Mhm.
per session. But the library sends it out through their listserv. And then I usually send it out through my health group in Everbridge as well.
is there any formal teaching or certification required for like coaches to coach any sports in New Canaan or anything of that nature that you're aware of?
Not
Other
that I'm
districts
aware of.
that I'm used to, to be a coach in a town, you have to go and sit through, a 30-minute program on things to look for in children and things of that nature. And I didn't know if there's anything formal that we have.
I'm
here in
not
town.
sure.
Darien had instituted something, and New Canaan is what they do have. They have meetings with the captains, go over what to look for with the student athletes, change in behavior, anything that's worrisome. So it's an ongoing meeting and conversation.
And I know the coaches attended that Zoom call that Brian had set up after the last
Yeah, right.
tragedy. Yeah. which was
I
really
didn't, I
good.
wasn't trying
But
to
I don't
build
know
on
if there's a
the,
formal,
wasn't trying to build on the tragedy that occurred in New Canaan or Darien. I just, when you look at holistically behavioral health and changes, often coaches, teachers are people that, are with the individual for the kids for a long period of time. I just didn't know if there was a formal certification program or anything like that that required approval, ongoing, not CEUs formally, but certifications so that, that can occur. And right now you're just saying it.
I have no idea about the school, so I don't want to say yes or no.
I'm not.
I know Janet Reed did it.
Yeah.
Before she retired, she trained all her nurses with the QPR, but I don't want to say something that's wrong.
Okay,
Yeah, I'm
just
not sure
with this
either, but
question.
there are some ongoing continuing education things in the coaching world.
Okay.
So Jan, looking at page number 2, I mean, it's impressive what this is community health updates, what the New Canaan Health Department's doing for the community. I mean, they offer lots of services. The other thing that I noted, that COVID statistically is just very impressive, overwhelming the other respiratory viruses.
Yeah. Oh, and I forgot to mention, I'm sure you read in New Canaanite, Dr. Reed is retired as of December 31st.
Okay.
And our new medical director will be Dr. Jamie Ruskowski from Comprehensive Care. And thank you, Dr. Pierce, for linking us with her a year and a half ago. She's been great
Really
to
great,
work
yeah.
with,
She's done programs for you, hasn't she?
a lot,
Yeah, that's great.
How many years Reed served? Seems like.
since
I
2009.
happen to know quite well. I think it was about 2002.
No, not for Dr. Reed. Janet Reed was that.
No,
Dr. Reed was
wow.
like 2009.
All right, we're gonna agree to disagree on
2009. Who
that.
was doing it in that interval?
You did it at 2000.
I did it. Yeah, that's why I was aware.
Well, you did 2002 to 2003.
Yeah.
Or 4, or 5, something. I
Yeah.
saw something.
Yes.
I saw.
Oh, right, that article.
I remember meeting with Dick Bond
Yeah,
Okay.
prior to that, like in
Yeah.
August of '01.
yeah.
And he said, would you like to be the
Yeah.
town director of health, et cetera? And I said, well, what does that entail? He said, honestly, just a phone call or two a year. So,
So you took it for the
Then-
money, Harrison, is that what you?
yeah.
It's not a high paying
There
job,
was a
trust
little
me.
stipend there.
It's,
That was not the motivator, believe me.
yeah,
So I said,
no,
yeah,
it's not.
I said yes, and then that was August, and then we had 9/11.
Oh, my
And
God.
it was to be in a practice like I was,
Mm.
and to be the
Health
health
director.
director. They were having meetings all over Connecticut. Bioterrorism, I had a book like this full of data and
Oh.
every bioterrorist chemical and means and everything else. It was like, so I hung in there.
Well, like COVID,
Yeah,
you
we-
and David were on a lot of the
Judy
COVID.
Neville became the first selectman, and
Yeah.
2 years later, I said, Judy, it's incompatible having this.
And then COVID happened.
And Dick didn't tell me though that he was a Christian Scientist.
Oh.
So,
Really?
yeah.
I
So
never
he
knew
just,
that.
when he said one or two, he didn't want any part of this whole healthcare thing.
Should I put that in the minutes?
Can you keep it out, please? Okay, let's see. Thank you, Jen. Marcy?
Good morning, Marcy Rand, Director of Human Services. I sent everyone all this information. Our numbers are just slowly going up. As far as clients, Jackie had a family move out and a family move in, so she still has 154 families. Her kid level, her child level is a little bit lower. Referrals and assistance are pretty consistent. I had 7 referrals for adults and seniors and 12 for youth and family this month. I won't bore you with all the meetings and stuff that we have participated in, but I did do a continuing ed at Silver Hill, which was fantastic. It was calming flashbacks and frenzy, de-escalation of post-traumatic and dissociative crises. That was fantastic. And then I also did a CEU on gratitude and brain health, which was fantastic. I kind of preach that to my bereavement group as well. I try to teach it to my kids. It really does make a difference if you make an attempt to be grateful for like 1 or 2 little things a day. Your brain isn't as smart as we all think it is, and so you can. But it's amazing, like how quickly we can be negative, and how hard it is to focus on the positive. So, and it does have a neurological effect. Gratitude does. So that's
Why don't
my,
we make that a regular?
Where did you get that? Where did you?
Program.
I'll send it
Hand
to
it to
you.
me,
I
yeah.
can't remember
No, for
who.
the whole town. Why
yeah.
not be grateful?
Oh,
It's like
a
it is-
slogan.
It's a
Yeah.
hard,
Yeah,
it's a
that's
hard
good.
exercise. It's a hard exercise to
Right.
do. Like,
Thank you,
No one
Deanna.
likes, no one likes. No one. But no one likes
know
to
it's
like
being
keep
videoed,
track of
so I
that,
just wanna
but it's
know.
really, it's important. Jackie did a bunch of webinars as well. A lot on strategies for suicide. She took a course on the power of positivity. So we can't be any more positive over in our department. We are just smiling. Come on over. We will be like, my support and learning group, Coffee with a Cop, that will hopefully start again in January. Nicole is now a,
Resource
There's a
officer.
school.
yes, a resource officer. So we're going to try to start to schedule officers who are on duty kind of thing. So that may even be a better thing because we'll have a new face every month
Mhm.
to do that. So that's great. My Life Reimagined is going well. My grief group is going well. My vulnerable population list has decreased by 1. That was a death. But that seems pretty consistent as well.
You think that, Tom Ferguson,
Yes.
you think the list is pretty comprehensive for all the people in town who are in fact vulnerable? Or do you think there are a lot of people out there that you don't have information?
You know what? If we don't know at all, we don't know. But I feel like it is pretty comprehensive because if I get an adult protective services referral or something, they automatically go on my list. And it is on our website. It is in Aggie's newsletter. So I think it's pretty comprehensive. And then those who choose not to be on it, they have that right to.
You know, I was at the Meals on Wheels board meeting and they were talking about how some of these people that you deliver to, you're concerned about just because you can see they're isolated or you can see the food is sitting out. And they said, what can we do? Can we tell somebody? He said, you really can't. I mean, you really just, they have to come to the commit or to the human services, right? I mean,
Which is so hard to
Right.
understand because, you know, like I will have neighbors or something say, can't you just go over? And I
Right.
said, that's really intrusive and I can't if I'm not invited to like do that. So I do steer, if you're really concerned, steer them towards protective services. Because
Mhm.
then once protective services is involved, they usually will call me and then I can become a familiar face. I'll go over there with the social worker from the state.
The other part of it you might want to think about, Marcy, is when the meals that are packaged up and everything and the boxes are put in, it wouldn't be such a bad idea if there's a flyer or a card or something that could be put in there and you're not aggressively doing it, but it's putting it in there. The person's eating the meal and looks and goes, oh, you know, I'm relating to some of this and maybe that, you know,
Yeah.
I think we tried that at Staying
So-
Put. I think we did, they let us do that
Did you-
once.
yeah.
I don't remember.
How
any
it
response,
went.
but-
over.
Yeah, well, it's such a small group, but
Yeah.
yeah, other people have said what a good idea.
well, I mean, the number of meals that are getting delivered every single day has gone up
Yeah.
dramatically
That's
over
great. That's
time.
amazing.
So I'm just saying it's an easy thing for us to do, you know, it's prepares to stick something in if you'd like us to, you know, but I've checked with Meals on Wheels, to make sure that they're,
Maybe around the
That's
holidays
good.
too
that's
is a good
great idea.
time.
Yep.
Yeah.
It's a great idea.
As a thought, I was on a statewide Zoom of behavioral health service providers on Tuesday. I walked away scared to death because what's happened is apparently unbeknownst to the general public, there are like 6 Project 25 people that have now been assigned to RFK's group. And I don't want to be political about this, but what's happened is they're part of Project 25 is backing off Medicaid and behavioral services. These people, and there were 4 state agencies there as well as all these providers. Everybody's worried about what's the downside and preparing for it. Nobody's thinking about how to improve service and et cetera, et cetera. I was astounded. But, and obviously there's a lot of ifs, ands and buts involved in the process. But in point of fact, during this time of the year, and my question is whether you're noticing any back off in service providers in the behavioral health thing yet. Because you can't have all these people talking about this without eroding service at some point. So stay tuned.
Just data point, Norwalk Hospital is much more serious about that. Their inpatient unit, now they've got it in the emergency department, pediatric section, which they've been talking about forever because ERs are really tough for folks. But I think locally, the commitment seems to be going up on behavioral.
Stanford
services.
Hospital also, it's not for elderly, but they have a whole new wing, they took the old part of the hospital. It's literally kind of a kids in crisis type of thing where they are providing more beds. That is a huge.
Well, that was the bottom line of this, of the whole thing, was that everybody was concerned that particularly children will take a hit in this thing. And if Project 25 is to basically reduce the federal budget, they're going to look at soft services as a way to do that. So it's creating some havoc.
well, there's always been a shortage of regional inpatient beds for geriatric side. Can move more to the outpatient side. You go into a psych emergency and the psych screening program through the hospital. All hospitals have it. but finding a longer term bed has always been an issue. I think the funding has never been there, right? And I just think that's always been a challenge for a healthcare provider, all healthcare providers in finding the coding and the payer mix in order to make it effective without doing it on a either private pay basis or an outpatient basis. So it'll be continuous a problem as it's not going away.
It's a huge contributor to the boarding crisis.
100%.
To the what crisis?
The boarding crisis. in
Yep.
emergency departments. I mean,
Right,
behavioral
boarding.
health holes can be 72 hours plus.
I mentioned this before, but Connecticut State stepped in with Norwalk Hospital. Norwalk wanted to build this tower for whatever, millions of dollars. Start at 120, went to 150, 180, where it is now. Because they discontinued their inpatient psych unit. So they were blocked. So the Norwalk said, okay, they're gonna redo it. And there was community pressure too. Dr. Myberger was a psychiatrist on the staff for a number of years, wrote a long influential letter to the hospital administration, community, Nuvance, et cetera. So, I mean, it's just statistically, it is where it is and you have to deal with it. So hopefully these Project 25 things will see reality, or there'll be enough push against that they don't take effect.
We'll say the last thing on Norwalk, the Northwell combination is going to be really powerful.
Oh, yeah.
They're incredibly committed to local community, and they're really committed to building up a lot of Norwalk's capabilities and investment in a lot of areas, and
Yeah.
behavioral health will be a part of it. I mean, it's still going through the regulatory side of things, but it's going to be a huge plus.
Yeah, they have about 27 hospitals in their grouping now. Long Island, New York, now Connecticut. And
Westchester.
yeah, they're-
Nice. Plus.
their philosophy is to keep it at home. So you don't have to go to all the tertiary care. I mean, you can, still going to need tertiary care hospitals, but just to upgrade all of the local hospitals like Norwalk. There are 7 hospitals in the Nuvance system. So they will all get some kind of an upgrade, and financially too, because Northwell has got some bucks.
And I know that they're really focused on Norwalk of all the Nuvance hospitals, because they really want a presence in Fairfield County. And they're also have a great reputation for honoring community hospitals and doubling down on that, not trying to be, big system and go to our magnet hospital. So it's going to be really positive for the community.
And we'd heard the same thing when Nor joined Nuvance. So I mean, the proof's in the pudding over time. It's always good, the marketing, the goodwill that comes early on, but you have to watch it. And we've competed, my previous life when it was North Shore LIJ. And so you get a sense of Michael's as a CEO, his reputation, what he wants to do. And I know he is focused on Fairfield County, which is a good thing for all of us. But we're talking about mental health and behavioral health. The emergency departments are still hugely impacted by mental health and behavioral health, and blocking up beds and timely access. And that's continued to be a problem.
Your words are well taken, proof is in the pudding, because I mean, even with the Northwell deal, just looking at a perspective from pediatrics. So Norwalk Hospital had a great relationship with Yale through the years. And then a different administration came in, altered things, went with New York Medical College, which was over the state line, et cetera.
Mhm.
And you've got Yale right up the street. So they made some decisions there that really had a negative effect on Norwalk. And not only pediatrics, but zillions of departments.
Agreed.
I mean, they had a pathology department that was moved up to Danbury. It was great to have it there. The radiology department, they dismissed. Stanford was wise enough to bring them under their loop, and they're thriving, and, go OBGYN right down the line. It's just been
Can I ask, who owns Northwell? Is it a-
Northwell, I think.
Is it just a private?
Northwell
Is
is the sole member of all the hospitals. It is the parent.
It originally was LIJ North Shore.
Okay,
North Shore LIJ.
Long Island.
Yep, yep,
Very top hospitals there.
okay.
yep. We competed against Catholic health systems of Long Island. a lot of changing dynamics, and you're going to see a lot of changing dynamics for our elderly population, Medicare Advantage, and the changes that are coming with enrollment, especially in Connecticut. This is not a market that many payers are expanding into for Medicare Advantage. So we have, just to piggyback on what Jen was saying, December 7th, just to remind everybody, is the last day of the enrollment, changing enrollment, updating for our seniors.
Right. I better get there.
That was for Peter's benefit.
Now that I'm a senior, yeah.
I have a few more things to
Yes,
say.
yeah, go ahead. That's fine. I was just-
Mark, back to me.
I was just kind of reoriented.
Super quick, our alcohol prevention newspaper article, you left me a voicemail, you were curious about that. That will be in, and it's gonna be in for a month.
Okay,
So
because I
it
looked,
started-
the advertiser didn't have anything, so it's going to be December.
Yes,
Okay,
month
so
of
yeah, there was no
December.
Thanksgiving.
yeah. it'll
So
be
we'll
the
get
month of-
4
Yes,
publications.
correct.
Okay, so it's the advertiser and the,
I think we're
Sentinel
doing
or-
the Sentinel,
okay,
yeah.
Good.
same price as last year? or-
Enza was in charge of getting the pricing for me,
Okay.
but she said it was within a couple dollars,
Okay.
so, yeah. We spent $9,800 on $100 gift cards for 98 kids under the age of 18. We give those Walmart gift cards to families with children under the age of 18. We are in hopes of having a donation button within the next
Oh.
month or so.
Wow,
I
great.
feel like I'm a broken record. I've told you guys that a couple times, but I swear it's happening. And so that will hopefully help us next year as far as fundraising and, well, or throughout the year, but that will help the cause a little bit. And then in the 18th of December, the fire department is going to be going to St. Mark's with gifts for kids under the age of 10, and that's 33 children. The firemen will be delivering wrapped presents. The Boy Scouts are wrapping them. And the police union gave 34 turkey and chickens to people for Thanksgiving, so.
Getting back to the fundraising, there's that thing called, is it called Giving Tuesday, or I can't remember now, in April, that all the nonprofits, can do, and
Yeah.
it's free for whoever, it's free for the organization. That might be a thing you could do, and then you send out an e-blast and
Yeah,
get some funding that way, because people sometimes.
I think this was this past week.
Right,
Yeah,
or not Giving
it's
Tuesday, what's it called?
Tuesday.
It's gosh, I should remember. It's Fairfield County Giving Day. Yeah, it's in April, and you just sign up as a nonprofit and you get,
well, with
you
Hope,
send out
we'll have like
a.
a QR code and stuff by then.
Yeah,
so
that's another way, but that's just sort of an awareness building thing.
It's a lot.
It's just a cheaper way to advertise
Yeah.
and market yourself, because you're doing it to a group effort
Right.
by putting in.
Absolutely.
You might get some
Yeah.
donations.
Okay, so now I'm done.
Okay. All right.
There is no more.
Thank you, Marcy. I see you mentioned having Kathleen Benevento. So she spoke at the New Canaan Men's Club. You were there, Jim. I don't know if you were there, Tom. But anyway, she's very impressive. And we had the discussion last month of bariatric care, diagnosis, et cetera, et cetera. Well, Waveney offers superlative. It's more of what they call the social versus the medical program, but it was impressive. She did a great job.
Thank you.
Old business. Thank you, Marcy, by the way. Old business grants. So we went through the grants where the one thing we didn't mention was a community program for mental wellness. That's the vigil. We give $2,500 a year. They don't ask for more, whatever. So that's done. And I guess with all the grants, it just goes to Board of Finance and Board of Selectmen to approve if we, pardon me?
All
Oh, good. Okay. That's good. All right.
Yeah, but everything will be what we.
We've got, yeah.
So
All right.
that's-
Yeah, wow. Last December was a very different meeting, as I recall.
Liaisons. I've been the person for the Kids in Crisis Teen Talk Counselor. I did speak with Martha Wheaton and a couple of weeks ago. So I just looked at her schedule. She has about 4 scheduled clients per day. But lots of walk-ins. I asked her, what are the issues? She said, just stress. It's primarily, it's family, and then it moves down to social and academic. One thing that was impressive, she said, and I think it was a senior student suggested having a mental health fair. So she and he did this. So they had it, over 100 students attended, and they handed out distributions of all resources for all sorts of medical, substance abuse programs in Fairfield County. So that was a positive. New Canaan urgent assessment. Peter, anything?
The 12 in November, just a little down to a shorter month, and they're seeing activity in December. There's going to be an article in New Canaan Darien Magazine focusing on
Okay.
on them and that. It's just really cool and interesting, and they're very eager to jump into the survey data. It will be a big part of that. So.
I did call Bethany a couple of weeks ago to let her know of my change in status, and she's very happy at Silver Hill. She's working as a clinical nurse on the floors, psychiatric floor, 3 days a week, 2 afternoons a week. She's also touring with physician groups, hospital administrators, I think insurance companies will assure that. And she mentioned about the urgent assessment. She said it's all New Canaan. She said they have, we have 16 allotted slots financially covered per month, and it has been 10, on an average of 10, and it crept up a little bit to where we got for 15 for 2 months. Back then, what was it? 12. So that's where it is. She said Weston has kind of pulled back on this because they were, they had 4 slots. They wanted it to go back to 2. The schools aren't feeding it like New Canaan schools do. So that was that with the urgent assessment thing. So a little change out there.
May reduce their funding, right?
Yeah,
Are they still talking about changing the name?
Yes. They wanted to wait until the survey data came out, but they're probably just gonna make it, they're gonna take the urgent out.
Yeah.
That's
Just
really,
it's scary. A couple of people that I know of.
if you have any suggestions, just forward them.
All right.
I did. And Alyssa McKenzie did want to talk to you about domestic violence, et cetera. She'll do it in January, but she just said the increased numbers of domestic violence. She said the human trafficking, especially in the New Haven area, is problematic. And also the abuse and the violence in these, in the communities of the handicapped children and adults. It's significant, the disabled. New business. Okay, so the holiday announcements are out. Gifts.
Oh, baskets? Yes. Yes, I have assigned 30. So I will be
That's,
sending you
is
guys
that more?
emails.
That's
for-
more, right? Yeah.
Sorry? I'll deliver a couple.
That's great, though.
I'll be sending you guys an email, next week. They're all due by the 16th. I know it's a really busy time for everybody, so I will try to.
So what's a
Well,
good,
I can.
Are they ready? Are they ready yet, or?
No, they're not. They
Okay.
haven't been handed in yet.
Oh, I see.
I can do up to 5 if you want. I mean, I have
Wow,
a
thank you.
team, so
Okay.
I know it's nice to go and say you're a commissioner and you
Yeah.
introduce yourself and everything like that. But sometimes people are just not at home and you just.
Right,
knock
just
on
leave it.
The door here.
Yeah.
and some are very happy to see you.
Yeah.
Invite you into the living room, sit down, and
Yeah.
you're there.
It's like Meals on Wheels, right?
Thankfully,
But-
everyone has.
But really, Meals on Wheels, you're doing about 10 meals. It doesn't take that long. I mean, we could do more than 2.
We could do more than 2.
When do you think the deliveries,
Well, there's due by the 16th, I think.
What's
what do you mean by due?
I've assigned everyone the person and what they would like in their
Oh.
basket. It's a basket that's been dropped off to us.
Oh, I see. So
Oh,
if
okay.
somebody picks,
So
So
somebody
it's
buys.
coming
the
to you on the 16th.
Yeah.
I was thinking the
16th?
23rd. Is that too close to Christmas? That's Monday. To deliver them to
Oh,
them?
no. You have the
Does that
idea
work
of
for you
23rd?
people? The 23rd or no?
23rd is good.
Yeah, I'm not. Oh, well.
Um,
I'm free all day on the 17th.
Okay,
help organize or deliver on it.
Look, we have a team,
Okay.
so whatever you need, whatever.
You'll let us know.
We'll make sure as
Let,
soon as I.
Just connect with us and then we'll.
You know, we're coordinating those.
What are we doing here today? The 22nd.
You got it.
Okay, all right. Good idea. Better write that somewhere.
Next item, Health and Human Services Commission, 2025. Gianna, would you?
Before.
Over there.
It's a big.
I wanted to start by thanking Dr. Pierce, and I can't call him anything but Dr. Pierce.
Is it my personality or what is?
No, you know what? It's my father who always made me, speak to people, and he won't let any of my friends call him by his first name either. It's ingrained in me. So it's a term of respect, and so I choose to do it that way. But I don't know if any of you know this, but when I was first elected, Dr. Pierce came into my office and said, Deanna, I've been on this commission a while, it may be time. And I said, please don't leave me. Right. I said, please give me a year at least. So he was gracious, as he always is, in being willing to serve an additional year to help me get on my feet. And so I will be forever grateful to you for that. And in honor of that, and I want to, thank Marcy and the commission members, and Peter, for coming up with this proclamation idea. And I'd like to read it out loud for the record. To Harrison J. Pierce, MD, whereas Dr. Harrison Pierce has been a pillar of the New Canaan community for over 50 years, demonstrating extraordinary leadership as a volunteer and playing a pivotal role in supporting the medical needs of the community. And whereas for 42 years, Dr. Pierce served as a dedicated primary care physician to generations of local kids, forging bonds with families and leaving an indelible mark on the health of New Canaan's youth. And Dr. Pierce served an unprecedented 5 years as chairman of Health and Human Services Commission from 2019 to 2024, identifying ways to harness the community as an asset to drive wellness and ensuring that sufficient resources are in place to address the myriad needs of all residents. And whereas Dr. Pierce masterfully led the town during COVID-19 pandemic, helping forge strong partnerships across town services, overseeing vaccine clinics for children, and providing expert guidance to the New Canaan Public Schools. And whereas Dr. Pierce has been an unrivaled leader in advocating for the community's youth, serving as the town's director of health from 2001 to 2003, that's where I got the date. Serving as medical advisor for 7 area schools and being a familiar and an inspiring presence on the home field sidelines during New Canaan High School varsity football games, even during torrential downpours, which I was able to witness this last Turkey Bowl. Now, therefore, I, Deanna Carlson, First Selectman of the Town of New Canaan, Connecticut, on December 5th, 2024, do hereby extend heartfelt thanks to Dr. Harrison Pierce for his devotion to the children of New Canaan and for his 5 decades of leadership supporting the greater community.
I have to thank you so much. That was, who wrote that?
I did, yeah.
No, John, it's been great working with you only, though it's been only a year, thank you. And with Kevin prior to you
Yeah.
also. And as I said in my email to all of you, I enjoyed working, serving, whatever the term is, on this commission with you for 5 years. So it's one of the things that's made it difficult to exit. So I have, this has really been teamwork because we've all been involved. We've dealt with issues over the last 6 years, 5 this year. And I think the New Canaan community is better for it, hopefully so. Anyway, so I thank you. I appreciate all the interaction that we've had. And like I say, teamwork. I mean, we're all involved in this to varying degrees and we all bring a little something. And it's been special. And just continue on.
Well, and
Come back and.
Thank you. This
while,
is,
while you may be coming off the commission, you're not moving. So we all know where you are. And,
I would, yeah, and I've, you know, Valerie Shannon calls me with some frequency.
It's always about her though. It's not about us.
No, it is. No, it is. Some of it's her family and her, you know, whatever, but also with town people and whatever. I said, please, you know, I'm still here. I'm still
We'll be
the
gone.
medical advisor for the schools. at
Yeah.
present, so
yeah, and we should
Yeah,
tell
I would-
Dr.
I would
Kwiatkowski to
really-
reach out.
like to help in any way I can going forward.
Yeah.
There.
Yeah.
So, you know, if there's another, hopefully not epidemic.
Yeah.
or
Like you're
pandemic,
telling me.
whatever, you know, I keep- you know, the
Yeah.
New York Times keeps us this avian thing
Yes.
bombing us every week with this.
Yeah.
Hopefully it'll never happen, but happy to be there, just giving those vaccines.
That was an inspiring sight when you were going in that first day and you were overseeing that whole process.
Now, we
Made you very, because Dr. Pierce is here. It's gonna be okay, right?
able to negotiate a serious retirement package.
It's, you know what? There are lots of positives, but she's a little tight. with money.
Is this on? Is this on?
Do a backtrack on that.
Did you just
Not in
get
the
a
minutes.
text from Tucker? I was recognized for my fiscal prudence that they advertised the contract for the
That's
second.
that's another way of putting it.
Really liberated.
I'm out for Monday.
What are you gonna say about us?
I know, wow.
Wow. It was a great parting comment.
It's been great, truly
Mm.
great.
Thank
And
you,
I will miss you all.
Harrison,
I'm
you've been
thinking of you
great.
and what you've been doing and I'm still here and part of it.
Yes.
in Spirit, if not corporeally or whatever.
Yeah,
Public meetings, New York, go visit.
Yeah, no, sneak me back there.
There we
Lots of road Zoom.
You guess.
there we go. So,
No, I am very appreciative.
we,
Happy I did
Yeah.
this.
thank you.
I think I'm happy that it's coming to an end.
Well, you know, there's always,
No,
you know,
there's- Today I'm okay, or at least I was okay.
Yeah,
We'll see what tomorrow brings.
there's other things, you know, people always leave and, you know, so there's always, you know, people can rotate back in if they want. Let me know.
Um,
Um,
So I guess we're coming to an end, correct?
Did you want to do officer elections today or do you want to do it next?
We can do what, yeah.
Okay, I don't know that this was officially on the agenda, so I would like,
Go ahead.
this is a publicly noticed meeting and it's your regularly scheduled meeting. So if I could get a motion to amend the agenda to add officer elections.
Well, I did have that as a kind of a subtitle, not on paper, under the
Oh,
HHSC 2025.
oh, okay, sorry.
That's okay.
No, that's okay, but then we'll make a motion to
Yeah,
allow the election and then amend the agenda for election of officers for Health and Human Services Commission.
second with Tom. Okay, all in favor?
All right.
There we go. Okay. So one of my favorite jobs is I do officer elections for all the boards and commissions. So do I have a nomination for the office of chair? Tom,
Bar Rockenbell?
okay. Do I have a second? Tom Lisher, Jim Lisher, sorry. This is not my gift. Great with faces. Names always trip me up. Okay, so I have a nomination in a second. Do I have any other nominations? Seeing none, if I could have, a vote for Marcy. Sorry,
For
sorry.
Marcy.
Barb.
Go for it.
Barb.
I'm voting absent.
Barb. Barb Ackenbaum for chair.
There.
It's unanimous. Thank
Except now
you.
that you've been secretary for a couple of times,
Yeah.
you may not want to leave that job.
It's pretty fun.
You can do both.
Being a secretary
Thank
was
you, Bob.
actually good training.
Yeah.
Let's
thank
stick to
you,
the
Barb.
agenda.
Thank you, Bob.
Thank you.
Well,
Thank
thank you for having the confidence in me. I appreciate it.
Yeah, no.
It's a tough act to follow. as you
Yeah.
know. Can I make a nomination for vice chair?
And when I call the vote, sorry. You're getting ahead of me. but-
Well, we have secretary as well, correct?
Yes, so we're gonna, I'll do vice chair first. Not every commission, but could I have nominations for vice chair?
I nominate Peter Campbell.
Okay. Tom Ferguson. Do I have any other nominations for the office of vice chair? Seeing none, all those in favor? It's unanimous. Okay, and then the office of secretary. Do I have a nomination for the office of secretary?
If I can nominate Jen Haddock.
Okay, do I have a second?
Second.
Russ? Any other nominations for the office of secretary? Seeing none, all those in favor? It's unanimous.
guys.
Thank you. Thank you, everybody, for serving. I appreciate it.
Did such a good job that one. time.
Yeah.
This is what-
Okay, good. I'll try to live up.
Here you go.
Did I won't be able to read my scribble though, sorry.
No, you know what, I really appreciate everyone's service. This is probably one of the, when I took on the role of first selectman, one of the hardest jobs is getting people to commit to the work that needs to be done for this community. So I really appreciate all of your efforts on behalf of the entire community because it's important, and it's important for the staff to have, sort of the community buy-in and support. So thank you all for continuing your service.
Thank you for what you do. So before we pass it over to our closer, par excellence, Merry Christmas, Happy Hanukkah, same date this year, 12/25.
Crazy. So crazy.
And Happy New Year to you all.
Thank you. Thank you, Harris.
Still working through the end of the month.
That's
So
right.
we're gonna.
Oh, yeah, we're delivering. We don't want to break that tradition.
Anyway, Harrison, on behalf of,
I hope she's still alive.
on behalf, as the closer, on behalf of all of the commissioners here and those that could not be here and the staff, we thank you for your leadership, for your heart and what this has meant to you and what you mean to us. So thank you for that.
Thank you so
very
much.
much. And for Barb, congratulations. You have her full support and everything. And we look forward to the upcoming year and really all the challenges that the town is, like any community, is struggling with right now and making an impact on that. So thank you all. Happy holidays to everyone. Thank you to our department heads, to our first selectman. May God be with everyone for a peaceful. I'm the closer, Peter. I'm the closer, Peter. So you need to know your role, your vice chair, Peter. Okay? Make a motion to adjourn before Peter.
The survey, there's gonna be a couple of public or meetings amongst folks who are involved in behavioral health in December. There's not gonna be one specifically for us because the public announcement's gonna be in January, so there are gonna be 3 separate meetings for people involved, so I encourage people to show up for one of them and you'll get a briefing, preliminary look at the results. So I mentioned that.
Good.
Thank you.
It was worth the wait.
To our closer.
Motion to adjourn.
And second.
All in favor? Always get a unanimous vote.